Hi, everyone. Thanks again for showing up and joining me today for this great presentation we're going to do, continuing our series on heart and brain health. Today, what I want to talk about is how to assess your heart attack, stroke, and dementia risk. Now, this is based on the book Healthy Heart, Healthy Brain by Drs. Bale and Dr. Doneen. Dr. Bale's a medical doctor, and Dr. Doneen is a doctorate of nurse practitioner. And for those of you who don't know, my name is Linnea Baker. I am a board-certified family nurse practitioner. Now, I'm using this book because it is evidence-based, and they have implemented these tools that they're giving us from this book since 2001. And so they have over 20 years of data. They've been published, peer-reviewed, so very evidence-based. And it blew my mind on all the things that are out there that we're not looking at as far as risks for heart disease and dementia and stroke, because they have updated it to include so much more than what we used to look at. And for those who don't know, I do have over 25 years working in healthcare, first as a nurse, and then later for the past 10 plus years as a nurse practitioner. And the majority of my career was in cardiovascular disease. So that's why I get so lit up about this information. And I want to empower you to have the education and knowledge so that you can present this to your providers and work on being proactive in your healthcare and improving those risk factors and mitigating them. So one of the things that's really important that they mention in the book is nearly half of the adult population have one or more major risk factors for cardiovascular disease in the United States. Over half, guys. That's incredible. But, we talked about before how half the population is pre-diabetic or diabetic and doesn't even know it, how 70% of the population is obese or overweight, and that number keeps increasing. And we also know that cardiovascular disease is the leading cause of death in the United States. So it all fits, right? It all actually, what we're seeing in the statistics is showing us exactly what this is saying. So when we do risk assessment for cardiovascular disease, we used to use something called the Framingham Risk Assessment to give you a 10-year cardiovascular risk scale, and it's very limited, and they go over this in the book, and we'll cover that later on. But that's something that I even use, that's the standard of care, and that's what the majority of providers still use. However, this Bale-Doneen method that they developed is more inclusive, asks more questions, looks at more risk factors, and is way more accurate in discussing and giving you a risk assessment number or like high, low, or minimal risk than what the Framingham risk model did. So what I want you to do is, if you're following along with me, if you want to take screenshots with your phone, you can. This all comes from that Healthy Heart, Healthy Brain book by Dr. Bale and Dr. Doneen. And I'm going to put a picture of the book up at the end. And I highly encourage you guys to get the book. It is written for lay people, not for medical professionals. So it's an easy read for people who have no medical background. That's why they did this, to give you guys knowledge and empower you to have these discussions and take care of your health. So you can get the book. I got mine on Amazon. But when we go through these questions, if you just get out a pen and paper, you can write your points down so you can add up what your risk assessment is. I'm doing mine as well. And then you'll be able to see kind of some of the recommendations throughout the book and what Drs. Bale and Dr. Doneen recommend. So this all comes from page 14 of chapter 1, where this is their tool for risk assessment. Okay. So the first one is, how old are you? If you're a male under 55, you get 1 point. If you're a female under 65, you get 1 point. A male over 55 years old gets 4 points right off the bat just for age. And females over 65 get 4 points. And typically the reason they that females get to be a little bit older is because we have a little more protection from our estrogen for heart disease. And we are seeing more and more heart disease and strokes and arterial disease in people under 55, 50 years old, men and women, and it's scary. But for the risk assessment points, that's why they didn't give you 0 points for under 55 or under 65 in women. But women tend to have estrogen protection until they're done with menopause. So they're saying you get 4 points in a female if you're over 65 or 65 plus years old, and men it's 55, because men tend to have heart disease at a younger age overall. But those numbers are getting worse in both men and women. Now, if you have a family history of heart attack, stroke, Alzheimer's, or dementia, 0 points if no. Yes, you get 4 points. Okay. The next one is a waist circumference with tape measure. Do not go by your pant size, waist size. Like men and women, especially men, but women too will sometimes have a pant size that's a waist measurement. Don't go by that. It's inaccurate. Get a tape measure, and you want to put that tape measure around so it's level and equal all the way around. It's not up or down. And when it goes around your body, it should be right at the belly button level. And don't try to suck it in, just a normal posture, not sucking it in or pushing out your belly. And then you get the inches. If you're a female and you have less than 35 inches in your waist circumference, you get 0 points. Women who are 35 or more inches get 4 points. Men, 40 inches, if they're under 40 inches, they get 0 points. 40 inches or more, they get 4 points. Okay. Now, what is your weight range based on your BMI, your body mass index? So this is really interesting because if you're underweight, you get 2 points. So you're at risk if you're underweight. If you're average, you get a point. If you are overweight, you get 3 points. And if you are obese, you get 4 points. I put the site from the NIH that Dr. Bales and Dr. Doneen put in their book, the https www.nhlbi.nih.gov, that whole one. You guys can copy and paste that. You can kind of take a picture and plug it in. But what it wants is it can calculate your body mass index for you. So all it will ask you is to plug in your height and your weight, and it will give you your body mass index, and it'll tell you where you're at. And then you'll know if what your points are for that. Okay, so continuing, we want to know what your resting pulse is. So if your resting pulse, when you're at rest and relaxed, if it's less than 60 beats per minute, that's 0 points. If it's less than 75 beats per minute, that's 1 point. If your resting pulse or heartbeat is 75 beats per minute or more, it's 2 points. And if you don't know, you get 2 points. Okay, not everyone knows how to do their resting heart rate. For your blood pressure, if it's less than 120/80, you get 0 points. 120/80 to 139/89 equals 3 points. So that means, say your top number is 124, but your bottom number is 75. If your top number's over the 120, it goes in the 3 points. So if any of the numbers are above 120/80 to 139/89, 3 points. If you're 140/90 blood pressure or higher, that's 4 points, okay? If you don't know, that's 4 points. And if you're taking any kind of blood pressure medication, then you get 3 points automatically, and it's a total of 3 points. So it doesn't matter what your blood pressure is on the medication. Well, it does for your provider and for your health and well-being. But as far as assessing your risk on this, they say if you are on a blood pressure medication, that's what you're going to go by. You're going to give yourself 3 points and not worry about what your numbers are to get a point average. Then your total cholesterol. If your total cholesterol is less than 160, you get 0. If it's less than 200, you get 1 point. If your total cholesterol is over 200, you get 3 points. If you don't know, you get 3 points, okay? That means you probably have some abnormalities because you're not really checking and paying attention, right? So 3 points. And then if you do take cholesterol medication, you automatically count as 3 points. That you just give yourself the 3 for that. And then that's your points. You don't worry about the numbers with the cholesterol medication on board. You just go ahead and get 3 points. And then what is the HDL or good cholesterol? And we talked about this before, but your HDL good cholesterol in female, if it's less than 60, in females, you get 0. If you're a female with over 60 or more, you get 3 points. Men less than 50 get 0 points, and males who have 50 or higher get 3 points. And if you don't know, you get 3 points. Sorry, that auto-corrected to PJ's darn thing. But if you don't know what your HDL is, just give yourself 3 points. So then we look at the bad cholesterol, the LDL. If that's less than 70, great, 0 points. 70 to 99, we get 1 point. 100 to 130 on the LDL portion of the cholesterol, you get 3 points. And if it's over 130 LDL, you're getting 4 points. If you don't know what your cholesterol LDL, the LDL portion is, you get 4 points. Now, which of the following describes your triglyceride level? We said triglycerides are related to also your sugars. So if your sugars are up, you tend to have higher triglyceride levels. So if your triglyceride levels are less than 100, you get 0 points. And if they're 101 to 150, you can give yourself 1 point. And if they're over 150, you're going to get 3 points. But if you don't know, give yourself 3 points. And then, are you diabetic or do you have high blood sugar? If no, good, 0 points. If yes, you're pre-diabetic, you get 3 points. If yes, you're diabetic, you get 4 points. And if your blood sugar has not been tested, give yourself 4 points. And this is really interesting. We talk about oral health with our overall arterial health, arterial disease and arterial health. So if your gums bleed, if you have bleeding gums, and you say yes, you get 2 points. Otherwise, 0 if you don't. Okay, so now we have talked about anyone who's been with me, working with me on a health journey, or has listened to some of the things I've talked about in these presentations. We talk about sleep really being like a medicine. Sleep is so, so important. So we want to describe your sleep pattern to know what points to give you. If you sleep soundly every night for 6 to 8 hours per night, you get 0 points. If you're a restless sleeper for 6 to 8 hours a night, you get 2 points. If you sleep less than 6 hours or more than 9 hours per night, you get 3 points. So too much sleep or not enough sleep, not good, right? Now, or do you snore? We've talked about sleep apnea and snoring as well before. So if you snore on occasion, you get 1 point. If you don't snore at all, obviously it's 0. If you snore frequently and loudly, you get 3 points. And if you have sleep apnea, you get 4 points, okay? Now, do you have an autoimmune condition or an inflammatory condition, such as rheumatoid arthritis, psoriasis, or lupus? I have an autoimmune disease, so I automatically get 4 points for my autoimmune disease. It's an inflammatory disease. So 4 points if you do, 0 if you don't. Your vitamin D level, very important, and we're going to be talking more about this. But if your vitamin D level is 50 or above, you get 0 points. If it's 30 to 49, you get 1 point. If it's less than 30, you get 3 points. And if you don't know, you get 3 points. Now, previously, my vitamin D, even being in healthcare and monitoring all of this, was less than 30, more than 20, but less than 30. So my doctor put me on a vitamin D supplement, and I need to go back and get it rechecked. But the cutoff was 20, it was 20 to 30, less than 20 we were treating, sometimes less than 30. But actually what they're saying is we want it to be 50 or higher. So we're going to talk a little bit about that as we go along as well. But this will tell you if you've gotten your vitamin D level recently and you know what it is, go ahead and give yourself points based on what it is. And if you don't know, give yourself 3 points, because I will tell you the majority of people in the United States have low vitamin D. Do you have a history of migraines? So if you've never had a history of migraines, you get a 0. If you do have a history of migraines and you've never had an aura, so aura would be that sensation that comes on before. So you may get a smell or a light type of aura where you're seeing lights, certain lights, halos, like around lights and things. That would be with a migraine is an aura. So if you have migraines, but no aura sensations prior to the migraine starting, you get 2 points. But if you do have migraines and you do get that aura sensation before, as the migraine's coming on, then you get 3 points. And then how do you deal with stress? How do you cope with stress? Do you think that you're pretty laid back? I'm not. I think I'm not. Most people are not pretty laid back with stress. You'd get 0 points. But do you have healthy ways to cope with stress? I do. So if you have healthy ways to cope with stress, you give a point. If sometimes people say you seem stressed, that's 2 points, because you may not even realize it. There's been times in my life that I was stressed and thought I was dealing with it well and didn't realize how stressed I was, but other people noticed it. So you would give yourself 2 points. If you feel stressed and anxious most of the time, give yourself 4 points, okay? Remember, we're not here to judge, and I'm not here to make you feel bad for any reason at all. What I'm trying to do is go through this risk assessment to give you the tools to truly identify how much risk you have for these heart disease, stroke, arterial disease, dementia. Because once we know, when we know more, we can know better, do better, right? Education is powerful. And if we're in denial and we're not paying attention, then we're going to cause more harm to ourselves. So if we are paying attention and we're figuring out where we're at, and we're doing these risk assessments, and we're seeing our healthcare provider regularly, and we're working on mitigating and modifying risk factors so that we can improve our risks, right, and decrease our risks. So there's a lot of these that we can control and improve, but we won't know unless we've faced it head on and gotten the real information, whether it's blood tests, our doctor's appointments, and just answering these questions, right? So do you spend 11 or more hours per day sitting? No, 0 points. Yes, 4 points. So if you're in a sedentary job, or you watch a lot of, if you're on the screen a lot or watching a lot of TV and you're sedentary a lot, you're going to get more of a risk factor. So give yourself 4 points if you're sitting more than 11 hours a day. Now, how much exercise do you get? If you get at least 30 minutes, 5 to 7 days a week, 0. At least 30 minutes, 2 to 4 times per week, you get 1. And 30 minutes 1 time per week or less, you get 2 points. And if you don't, exercise, you get 4 points. So go ahead and put that down. And then do you use nicotine of any kind? So if you're chewing, if you're using cigarettes, cigars, e-cigarettes, nicotine gum, or if you're vaping, or any combination of the above, if it's got nicotine in the product, it counts. If you've not used it, or you're not currently using it, 0. If you used it in the past but quit for the last 5 years, you get 1 point. And if you're using it, or if you used it but quit less than 5 years ago, you get 2 points. And if the answer is no, I don't use nicotine, but I do have a consistent exposure to, or regular exposure to secondhand nicotine, then you get 3 points. So if someone in your house is smoking in the car or in the house, you're around them. We even talk about third-hand smoke, where people will say, when I was in pediatrics, the parent says, well, I smoke outside. Well, it's on your clothes. So we used to tell them, because of third-hand smoke exposure, to put a jacket or some kind of different shirt on when they go outside to smoke, and then take it off when they come in and change their shirt. Because if they're holding and with their children, they're inhaling third-hand smoke, okay? And then if you are smoking and have smoked, 4 points, okay? Unless you fit one of those other categories. Do you drink regular or diet soft drinks? This is a risk factor, guys. Can you believe that? So I used to drink a ton of diet soda. I told you guys, Diet Dr. Pepper was my kryptonite. And 3 years ago, I quit. It was April. We're almost there. It's 2 days away from my 3-year anniversary when I'm doing this. So April 20th of 2020 was when I stopped completely cold turkey, stopped drinking soda. So I get a 0 now, because I'm not drinking any. But if you drink soda rarely, you get a point. If you drink it once per week, you get 2 points. And if you drink it more than once a week, you get 3 points. I probably should have had 10 points, because I drank multiple sodas all day long back then. So that's for the regular diet soft drinks. And then, do you watch the amount of carbs in your diet? So are you limiting simple carb intake? With the health plan that I do, the nutrition plan that I follow for holistic healthy lifestyle, I do limit simple carbs. I don't worry about complex carbs, but I am cautious on my simple carbs. So you would get 0 points if you're aware of that and monitoring that. Now, do you know to balance your carbs and proteins? You get 1 point. If you never watch your carbs, you get 2 points. And if the majority of your diet consists of carbs, you get 4 points. Now, I will tell you, 3 years ago, the majority of my diet was carbs. So I would have gotten 4 points. But from 3 years ago to now, in the last 3 years, I limit my simple carb intake. So now I went from 4 to 0. See how I modified that? On the soda, I went from 3 to 0. So that's 7 points towards my risk factors for cardiovascular disease that I was able to take down to zero just by making lifestyle changes. Okay. So those are modifiable risks. When I say modifiable risk, that means we can do something to improve our risk factors. Okay. Some things we can't change. Like this one says for women only, if you had high blood pressure, preeclampsia, or gestational diabetes during pregnancy, you get points. You get 4 points if you did, 0 if you didn't. Well, that's not something you can change. You either did or you didn't. That's not modifiable. But whether you're watching your simple carb intake or drinking sodas, those are modifiable. You can do something and take those points down. Men, if you have erectile dysfunction, no, 0 points. Yes, 4 points. Why? Because erectile dysfunction is actually the small microvascular blood vessels. So if you're having problems in those smaller blood vessels, and one way to know that in men is if they have erectile dysfunction, then they're getting some kind of disease in these smaller blood vessels that can lead to disease in their bigger blood vessels later. And that's why we count that. Okay, so what does this score mean? What do we do now when we add this up? So if you had 2 to 4 points, Doctors Bale and Doneen say, hey, congrats, you're taking excellent care of yourself, and the book will help you maintain and enhance your cardiovascular disease health, because maybe you're younger, and as you get older, you want to be aware of things that change. You want to be empowered to know what to watch for, what blood tests to be checking to make sure you stay in that lower risk, okay? And then 5 to 10 points. If you total of all the points added up was 5 to 10, then you have relatively few risks for cardiovascular disease, but you can still benefit from learning how to optimize your heart and brain health with easy action steps they give you in the book. If you're in the 11 to 20 point range, you have definite risks for arterial disease. And this book will help alert you to what you should be doing right now to counteract those health threats. And they recommend you follow the 6-step prevention plan in chapter 2. And then if you have 21 to 39 points, you're at moderately high risk of cardiovascular disease, CVD. And part 1 of the book helps you identify and overcome hidden medical problems that may be putting your heart health in jeopardy. So important to know, okay, guys? Now, if your points totaled 40 points or higher, you're at high risk for cardiovascular disease. And in order to prevent a heart attack or a stroke and reduce your risk of dementia, Dr. Bale and Dr. Doneen recommend that you go get a comprehensive cardiovascular exam. And they said that they say to include the tests discussed in chapter 2 or part 2 of the book, not chapter 2. And then part 3, they go over therapies and lifestyle changes that will help ward off some of the cardiovascular events and memory impairment. That was on page 19 to 20 of the book. So if you're at high risk, go ahead and get in and get a comprehensive cardiovascular exam with your healthcare provider. Get your referral from your primary care if you need to, if that's how your insurance works. And I would say, don't wait. Don't wait. Get in there and start working on this now. Sooner is always better than later. But while you're going and getting an assessment, go ahead and get this book, because it can give you more information to help you take better care of yourself and reduce some of those risk factors. Guys, I'm on a mission to positively impact your health and wellness to create generational health. And that just means that when I help parents and adults get healthy, then you impact your grandchildren, your children. They're going to follow, because more is caught than taught. They're watching and they're absorbing what you're doing. And we want them to have a long, healthy life as well. And they're going to follow in your footsteps. So when I help you on a health and wellness journey, we create generational health for your family, your future generations, guys. What a legacy to leave, right? And I also want to give you a health span that equals your lifespan. We said before that the last 13 years, there's research that says the last 13 years of our lives that we're alive, of our life that we're alive, is basically where we don't have quality of life. We're unhealthy, and we're in a lot of doctor's appointments, and we don't have quality of life. We can't do the things we want to do. I want you to have a health span that equals your lifespan. I want you to be able to do the things you want to do, and have good quality of life as you're aging, and be able to be present with the people you love most, and not feel so bad and down that you don't have any energy, or you don't feel like doing the things that used to excite you, because you just are in poor health. I've seen it so much in my career, and I don't want that to continue. I don't want it in my life. And I'm helping bring education to all of you so that if you want what I want, which is quality of life and a health span equal to my lifespan, that you can take some of these tools and apply them to yourself. Obviously, while working with your personal health care provider who knows you best. Reach out to me if you are struggling with where to go on a holistic, healthy lifestyle. If you're not sure where to start, if you're frustrated, if things haven't worked, I have a lot of tools to help. So reach out to me for a free health consult. Sorry, reach out to me for a free health consult by commenting below, or you can private message me. Remember, this is educational. None of this information is to replace guidance given to you by your personal healthcare provider, but it is to empower you to go have those conversations with your personal healthcare provider and whoever is taking care of you from a medical standpoint, whether it be a nurse practitioner, a PA, a doctor of osteopathy, an MD, whoever your healthcare provider is. Okay. And then this again is a picture of the book, Healthy Heart, Healthy Brain by Dr. Bradley Bell and Amy Doneen, who's a doctorate of nurse practitioner. And I highly encourage you guys to get this book on Amazon. It's very powerful. It gets me really excited. I've been in healthcare a long time. Like I said, majority of my experience was in cardiovascular. So if I get excited about this, you guys should be excited, okay? This is a big deal. So until next time, guys, thank you so much for your time. I know it's valuable. I hope this brought you some value in education to empower you on your personal health journeys. And until next time, guys, stay safe.